On a gorgeous day like today, it's only natural to want to get out in the sun, but before the fun, make sure you are taking steps to protect your skin. We have Dr. Noel George joining us this morning with the sun safety rules that you need to follow in order to stay away from serious skin damage, sun damage, whatever. They're all the same thing and you want to stay away from it. Doctor, this morning here, it is Sun Safety Week. And we want to make sure that people are protecting themselves because it's unbelievable, but in 2017, still not enough people are wearing that SPF. Is that the key in all of this?
It is true. Wearing your sunscreen every single day is important, 365 days a year. It's
now, is it really the overexposure that is resulting in these cases of skin cancer that you're seeing?
The most common forms of skin cancer, which are basal cell skin cancer and squamous cell skin cancer, primarily come from just the daily little bits of sun we get going about our routine activities. Melanoma, which is the most deadly form of skin cancer, happens after several blistering sunburns over your lifetime, or the risk of that is much higher after blistering sunburns. So it's both kinds, the daily part and the severe sunburns that lead to skin cancer.
So really with kids these days, they want to make sure that they're, that we're starting from a young age and protecting ourselves before we go outdoors, putting on that SPF so that we don't have those problems later in life.
Absolutely, it's very important. Nothing beats staying in the shade, wearing sun protective clothing, but when you do go outside, make sure you're wearing at least an SPF of 30. Ideally one that has zinc oxide as the primary ingredient. Put it on heavy, reapply it often.
I was gonna say, because you see all those different numbers, so is 30 kind of the magic number? I know that's usually a debate, what number do I wear and how often do I put it on?
Right, at least an SPF 30 is very important.
Okay.
When you go from a SPF 15, that protects about 93% of the ultraviolet light, and SPF 30 blocks about 97%. So even though you double your number, you're not doubling your protection.
Now, we're talking about skin cancer as well, and so obviously there are going to be people who have it or are going to need to treat maybe not melanoma, but a step before that. And there's kind of this up and coming, growing in popularity treatment for skin cancer. I believe that is, what is that called?
Radiation therapy,
yes.
SRT, so superficial
what is the deal
radiation
with that?
therapy.
Yeah.
Some people are using it to treat skin cancers, but it's certainly not the most effective or first line of treatment. Surgical management remains the most effective with the highest cure rate. It's delivering doses of radiation therapy to the skin cancer area.
Okay, so if people going into their doctors, should they be asking, what types of questions do they need to be asking, and how often should people be getting those moles checked?
You should be getting your moles checked once a year. We say check your skin, check your birthday suit on your birthday. What kind of questions should they ask? What is the most effective way to treat my skin cancer? And also, cosmetic results outcome are important to people too. Radiation therapy, it may look better initially after it's treated, but actually the long-term outcome of the cosmetic result is worse than often surgical options several years out.
Right, and at the end of the day, we just want something that's going to give us the most years on our life.
Yeah, and cure the cancer.
Absolutely. Dr. Noel George, thanks so much for joining us here this morning.
Thank you.
I'm going to send it back over to Randy.
All right.